A very good morning, bachcho. To the best of my memory, I have completed the joints in the last class. Please say the thumbs up or just tell me. Please inform me. Good morning, very good morning. Good morning, bachcho, good morning. The skeleton was over, I'm pretty sure about that. I'm just doubtful about the joints. Good morning, good morning. The team is still mending the application. Good morning. We have to start with the joints. Okay. In the body, we have three types of joints. How many types? Three types. In the body, how many types of joints are there? Three types. We can call them cartilaginous. We can call them cartilaginous, fibrous, synovial. Whatever I am writing in the class, please copy. See, if you sit only passively, chances are there that the connection can be lost. Therefore, I always believe if the teacher writes anything on the board, please, you should also write that in the copy. If the teacher is just explaining by making some line, no need to copy everything. But then if the teacher is writing any flow chart or a special diagram or making something easier, it is better to use your fingers to involve yourself completely. Remember, it is not a YouTube, it is a live class going on. So you can take the advantage of the live class also. Synovial joint, second type, cartilaginous. They are semi-movable and fibrous joints. Fibrous joints are immovable. They are semi-movable and they are freely movable. Immovable, semi-movable, freely movable. But before that, if I ask you one question, tell me, I just want to align you all. Tell me, at what level trachea divided into two primary bronchi? What is this level? At what level trachea divides into two primary bronchi? Question number 2. What are the upper and the lower levels of kidney? What are the upper and the lower levels of kidney? The upper one and the lower one of kidney. Question number 3. What are the upper and the lower level of the scapula? Upper and the lower level of scapula. This upper level and lower level. Haan ji bachcho. So 3 questions are there in front of you, starting with the trachea. Let me see who is going to tell the trachea. Trachea divides into two primary bronchi. The right primary bronchus, the left primary bronchus. At the level of, write down the answer. Yes, it is T5. Good. I take that. This is T5. Thoracic 5 vertebra. T5. The trachea divided into two primary bronchi. Now coming to the kidney. Don't blame me. I know it doesn't look like a kidney. Okay, so kidney, the upper and the lower levels of the kidney. Kidney का बोलो, kidney का. Yes, T5 correct है, but it is of the trachea. Trachea T5. Trachea T5. Very good. Kidney. Sandhya was the first one. Sandhya and Sahasra, they are the first one to write the answer. Manasa, very good. Shrigita, good. T12, L3, last thoracic, third lumbar. We can say the level is T12, L3, lumbar third, last thoracic, third lumbar. And finally comes the sternum. Scapula. Upper and the lower level of scapula. How many S I'm using here? Scapula. Come on, bachcho. Scapula. Scapula. S. Scapula. From the level of dash to dash. Yes. Very good. ये है ना T12, L3. This is perfect for kidney. Scapula. Shanmukh, Manasa, they are the first one to answer. Sabira, very good. second to seventh, and that is rib. Very good, very good. Chava, Muram, Sandhya, good answer. Shrigita, correct answer. Second rib to seventh rib, very good. Narsimha, very good. Second to seventh, second to seventh, second to seventh, seventh. Second rib, seventh rib. Perfect answer. देखो बेटा ये तीन है. I know there are more than 250 to remember in first year. In the first year, more than 250 are to be remembered. And this is ठीक है, I am asking. But then those were, and that question will be asked by the teacher who do Viva OC examination. So many things can't come whenever someone asks immediately, we are standing in front. But then this is part and parcel, and we all will be put inside the blast furnace, so that when we come out of that blast furnace, we are as shining as the best quality gold in the world. Okay, now I was discussing with you the type of joints, the three type of joints. We have fibrous, immovable, semi-movable, freely movable. Examples of the immovable joint. Come on, bachcho. Example of the immovable joint. Example number one, the joint between the skull bone. Joint between the skull bone. And you know, it looked like that we have stitched the two bones together. The two bones have been stitched together. Therefore, because they look like stitches, we can call them sutures. What we can call them? We can call them sutures. Sutures. This is how we pronounce it. Sutures. S-U-T-U-R-E-S. Sutures. What are sutures? The joint between the skull bones. Another example, just remember one example. Cartilaginous, remember two examples. Number one, intervertebral joint. Number two, pubic symphysis. Symphysis. The meaning of symphysis is where the two bones are joined with the help of, they are fused with the help of a cartilage. Can you tell me which cartilage help in pubic symphysis? Which cartilage? In fact, the same type of cartilage is also in the intervertebral disc. The same type of cartilage is in the intervertebral disc. Let me see who is going to tell me the answer for the first time. Yes, you are right, Kavita. Perfect answer. Answer is fibrous cartilage. Yes. Don't get confused by the joint. Joint bhi fibrous hota hai. But this is a fibrous cartilage. Yeah, fibrocartilage. The cartilage, fibrocartilage. Pubic symphysis is normally non-movable, immovable. But in case of women, at the time of parturition, with the help of some hormone like relaxin hormone, a peptide hormone, relaxin, the pubic symphysis become somewhat movable. And you know the obvious reason why the pubic symphysis move at the time of parturition, to assist in childbirth. Parturition. Okay, beta, synovial joint. All the synovial joints are characterized by a synovial membrane. There is a joint capsule, a separate joint capsule. All the synovial joints, they have a common structure, a joint capsule. Never forget one very crucial point, never forget. And the point is, at the end of the long bones, there is a cartilage called articular cartilage. I repeat, at the end of, at the end of long bones, there is a cartilage called articular cartilage. Which cartilage? Articular cartilage. Where? At the ends of long bones. Which cartilage? What this cartilage we can call it? Articular cartilage. You can see this is the articular cartilage at this end, and this is the articular cartilage at this end. Now this is a very, very important cartilage because it keeps the surface shiny, smooth. Now, those who are non-vegetarian eaters, those who eat non-vegetarian foods, and especially if you have eaten, okay, even if you have eaten this chicken also, because it's a vertebrate, or even goat, then it is even better visible. And if you have seen the big joints in a chicken, the big joints of the leg, at the two ends of the bone, you can see that on the surface of the bone, there is some shiny, smooth thing. There is some shiny, smooth thing. And that is called the articular cartilage. Articular cartilage. Identify the structure, bachcho. Let me see. Write in the chat box. Let me see who can identify. In one of the very big joint, let me tell you which joint is this. This is our knee joint. In the knee joint, this structure is in the shape of a cross. In the shape of a cross. Identify this tissue. हाँ जी बच्चों बताइए ये टिश्यू कौन सा है? Which tissue is this? No, only the tissue. White color fibers that I have shown. Hinge joint, na beta. I didn't ask the joint. I am asking which tissue is this? Which tissue is joining the two dash? Ligaments, yes. This is ligament. Very good. This tissue is ligament. And bachcho, don't forget, there is a separate joint capsule. A joint capsule, separate joint capsule made up of white fibrous connective tissue. And don't forget, there is a special membrane. In all these joints, there is a special membrane. You know what the name of the membrane? The membrane is called synovial membrane. The membrane is called synovial membrane. Which membrane? Synovial. This membrane is called synovial membrane. Synovial. Synovial membrane produces a fluid, a juice, a lubricating fluid called synovial fluid. Synovial fluid is, it helps to reduce the friction. Synovial fluid helps to reduce the friction between the two bones. What is this fluid called? Synovial fluid. The green color membrane called synovial membrane. This is, which joint is this? Synovial joint. Ligaments have been shown, the cross-shaped ligaments have been shown there. Synovial, I'll first label the synovial membrane. Because there are sometimes what happens that autoantibodies are produced in the body. These are the hostile antibodies. Generally, antibodies are formed, so we become relaxed that now they are there to take care of us. They can protect us. They are like our army, our group of commandos to protect us. You know that whenever something happens in the town, the police, the CRPF, when all failed, then finally came the army. And when the army personnel come, you, me, all of us, we feel that now, thank God, now they will take care of the situation. That's a reputation of army. The same is a reputation of army of proteins called antibodies. What are antibodies? It is an army of proteins. Our NCERT book writes that it's an army of proteins. But sometimes these antibodies become hostile. Rather than attacking our enemies, they attack ourselves. And we don't know why that happens. We don't know. Sometimes misprogramming. These antibodies are called autoantibodies. Auto means self. That means they will harm the self. Depending upon which organ, which tissue they harm. We have different type of autoimmune diseases. We have more than 2 dozen. How many? More than 2 dozen autoimmune diseases. More than 2 dozen common, which are there in the common book. I am saying graduation book, not even PG books, graduation books. Autoimmune diseases. All of them are characterized by formation of autoantibodies. Autoantibodies, they damage different structures. In one of the disease, the autoantibodies damage synovial membrane. In one of the disease, autoantibodies damage synovial membrane. Autoantibodies damage synovial membrane. ठीक है बेटा, इसको थोड़ा सा ऐसे कर देते हैं जॉइंट को, ठीक है. So in one of the disease, the autoantibodies come and damage the synovial membrane. The joint become very inflamed. There is severe damage happening in the joint. Too much of secretion, too much of pain. The joint become very painful. So the antibodies, these are the hostile antibodies. They come and damage the synovial membrane. This type of, and they will cause the arthritis. They will cause the arthro joints, arthro plus itis. Itis means inflammation. They will cause the inflammation of joints, arthro plus itis, arthritis. Can you identify the disease which I have just now shown you? Please identify the disease. Yes, you are right. This is, yes, Varalakshmi, you are right. This disease is called rheumatoid arthritis. I just now discussed about rheumatoid arthritis. The disease is called rheumatoid arthritis. It is the best place to describe the rheumatoid arthritis when we describe the synovial joint. Otherwise, at that time, we have to again make the diagram. My dear bachcho, what is common between rheumatoid arthritis and myasthenia gravis? Rohit Reddy, myasthenia gravis is a different disease. That was my question. What is common between rheumatoid arthritis and myasthenia gravis? Both are arthritis, sorry beta. Myasthenia gravis, yes, autoimmune. Yes, Uttej, autoimmune, very good. Narsimha, good. You are right. Why you are erasing? Both are autoimmune, very good. Acha, you don't want the name to be taken, but this is a chatting, YouTube chatting is visible to everyone, I believe. Okay, so what is the name, beta? What is the name? They both are autoimmune diseases. One of the diseases, myasthenia gravis. Any other thing common in between these two? They both are related to this chapter. I know rheumatoid is not given in this chapter, it is given in the chapter of human health and disease, but it is related to this chapter, it is related to arthritis, that's why I did that. So, bachcho, myasthenia gravis, in this, the hostile antibodies damage or block the acetylcholine receptors. In this disease, the hostile antibodies, they damage the acetylcholine receptors. These are the receptors of acetylcholine. The hostile antibodies, the autoantibodies, they come and damage the receptors. As a result, when the nerve impulse comes, the acetylcholine is released, but it is not going to make any effect. Reason being, these receptors are blocked. Receptors are blocked by autoantibodies. I hope you understand this. What happens? There will be weakness. The beginning will be weakness, ultimately leading to paralysis. Myasthenia gravis, in the beginning there will be weakness, eventually having paralysis. I hope you understand. So this is myasthenia gravis. Well, come back to this diagram. In one of the type of arthritis, a special nitrogenous waste start accumulating. Inside the joint. A nitrogenous waste start accumulating. Can you identify the disease? Nitrogenous waste start accumulating in the synovial joint. Nitrogenous waste crystals of this waste. Why? Metabolic conditions. Some people, due to some faulty metabolism, they are producing this more than others. Can you identify these are the crystals of crystals of dash. This leads to another type of arthritis, and that is called gouty arthritis. Gouty arthritis. This is called gouty arthritis. Gouty crystals of, yes, कौन सा nitrogenous waste है बेटा? Uric acid. Which nitrogenous waste? Uric acid. Uric acid crystals. You are right. This is gouty arthritis. How many arthritis that you have seen so far? Number one, rheumatoid arthritis. Rheumatoid arthritis. Number two, gouty arthritis. Two arthritis already you have seen. Any other arthritis where this articular cartilage start getting damaged, it is a wear and tear, normal wear and tear, especially occurring in old age, sign of aging, old age, especially seen in obese people, especially seen in weight-bearing joints like the knee joint, especially seen in weight-bearing joints like the knee joint. The treatment is, we cannot repair it, no medicine, nothing. Painkillers are temporary. But what we can do? Knee replacement surgery. Knee replacement surgery. We can replace this portion by a prosthetic. By a prosthetic. This portion can be replaced by a prosthetic. It is another type of arthritis. You heard this name. Did you hear this name? The third type of arthritis is called osteoarthritis. This arthritis is a sign of aging. In aging, old age, weight-bearing joint, weight-bearing joint, and what gets damaged? The articular cartilage. Damage हो जाएगा. Articular cartilage undergo wear and tear. With time, after 3 years, your car tire undergo wear and tear. If you drive it normally also, our car tire undergo wear and tear after 3 years. But what about the body organs? Yes, it also undergo wear and tear. But when we were young, the repair mechanism was very good. So it can regenerate, it can repair. But then as the age advances, after a certain age, the repair mechanism becomes a little weaker, slower. And as a result of that, there are degenerative changes, senile changes. So how many arthritis you have heard? How many arthritis I told you? 3. Rheumatoid, gouty, osteoarthritis. Rheumatoid arthritis, gouty arthritis, osteoarthritis. Rheumatoid arthritis, gouty arthritis, osteoarthritis. You can see that when we understand the synovial joint only, when we were understanding the structure of synovial joint, at that time only it is better to understand the 3 types of arthritis. This is the best time to understand the 3 types of arthritis. This is the best time to compare this autoimmune disease rheumatoid with this myasthenia gravis. Because when we compare at that time, we can understand something very better. My dear bachcho, the types of synovial joint. The types of synovial joint, depending upon the shape of the articular surfaces. So we can have the flat surfaces, pointed surfaces, ball-like surfaces. We have 5 different types. The first type is called the gliding joint. Which joint? Gliding joint. The second type of synovial joint is known as the hinge joint. The third type of synovial joint is known as the ball and socket joint. The fourth type is called the pivot joint. And the last type of joint is called saddle joint. And the happy part, not the sad part. The happy part is we are supposed to know only the NCERT examples. We are only supposed to learn NCERT examples, okay? So can I expect this from you? Yes, please. Beta, give me the examples of gliding joint. Gliding joint. Examples of gliding joint. The joint between tarsals. The joint between carpals. Good. The joint between tarsals and carpals. Gliding joint. 1, 2. Hinge joint. Give me 2 examples. 3 examples. 1, 2, 3. Question number 9, part C. Ball and socket joint, just give me 2 examples, 1 and 2. Pivot joint, give me only 1 example. 2 example better, okay. Saddle joint, only 1 example, enough. Give me 1 example in saddle joint. Haji beta, gliding joint. So I have given you this framework. We have to learn these examples in all of them. So gliding joint, come on, recall. Joint between carpals and between tarsals, hinge joint, the knee joint, the knee joint, the elbow joint, and question number 9, part C, which can be called as, which joint is that? Question number 9, part C, please open. Otherwise, it look like I'm doing spoon feeding, bache. Tell me. No. नहीं. बोलो आंसर बोलो. Answer. Or at least question बताओ. Question number 9, part C. Joint between the phalanges. Good. Joint between the phalanges. I can call it as interphalangeal joint. Good. Ball and socket, we have the shoulder joint and the hip joint. Shoulder joint is between the head of humerus and the cavity of pectoral girdle, and hip joint is between head of femur and acetabulum of the pelvic girdle. Glenoid cavity of scapula, acetabulum of the hip bone. Head of humerus, head of femur. Shoulder, knee. Pectoral girdle, pelvic girdle. Pivot joint, joint between C1 and C2. C1 is atlas, C2 is axis. Better only these 2 vertebrae are there where the alternate names to be remembered. In all the remaining vertebrae, only like C3, C4, T1, T2, like this. No need to remember any alternate name. C1 is the Atlas on the Greek mythology, the man who holds the earth. C2 forms the axis of rotation. So the skull along with the C1 is rotating on the C2. The skull along with the C1 both are rotating together on the C2. C2 becomes the axis of rotation. And the joint is called pivot joint, pivot. Coming to the another example of pivot joint, can you tell me any other example of pivot joint? Haji bachcho, any other example of pivot joint? Any other example? Haji, wrist and elbow, pivot joint is present. Beta wrist lo gliding, elbow hinge. Wrist lo gliding, elbow lo hinge. But where is this pivot or pivot joint? Which joint is this? Which joint? Is it elbow? Is it wrist? Kadu, it is radio-ulnar. Very good. First time the person said Krishnavini. Very good. It is radio-ulnar. Very, very good. This joint is the radio-ulnar joint. Radio-ulnar. ठीक है बच्चा, देखो ये radio-ulnar है. ये proximal radio-ulnar. Proximal. पहले वाला है ना proximal radio-ulnar joint. Rotational movement, radio-ulnar. And lastly, saddle joint. Saddle, I'll give you the answer. You have to tell me the importance. The first cm of the state. The first cm of any state. The example of saddle. The first cm of any state. There is no importance in the name of the cm. but just the importance in the first and C and M. First CM. हाँ हाँ बाबू गोली चाहिए. CM क्या होता है? CM. Yes, you are right. You are right. CM, Anuradha, you are right. CM. CM. C for carpo, M for metacarpal. Carpo metacarpal. Carpo metacarpal of thumb. Metacarpal, first metacarpal and the carpal. One minute. Proximal, middle, distal phalanges. Proximal phalanges, middle, distal. This is wrist carpal, metacarpal. 1, 2, 3, 4, 5. These are phalanges. Saddle joint is present between 1, 2, 3 and 4. Saddle joint is present between or present at बोलिए बच्चों. Saddle joint is present at बोलिए आंसर. You all are right. Answer is 3. This is the carpometacarpal of thumb. This is the first digit. This is the thumb. First metacarpal. I said this first CM, मतलब M जिसमें first है. A very quick commentary on this joint. This joint is making us humans, this is making us unique. All hominids have this type of joint wherein they can touch the tip of the finger with the help of the thumb. Now this is making the hominid a tool maker. Remember that before hominids, the Australopithecines, what they did, they hold the stone and they throw on the others for hunting. Remember, they didn't do hunting for eating, they did hunting for protecting themselves. Afterwards, when the first man came, Homo habilis, he could mend the tools, he could sharpen the tools, he could shape the tools, and this activity occurred because he got this type of thumb. So this joint that help us to move the thumb, touch the tip of the finger, this type of thumb is a very important evolutionary feature in hominids, a very important evolutionary trend or evolutionary feature in hominids. My dear bachcho, I hope this is clear to everyone. I'll now take you to the disorders. In the disorders of the musculoskeletal system, we have discussed one of the disorder, which is arthritis. I have to discuss the other disorders. Also, I discussed about myasthenia gravis complete and arthritis, 3 types of arthritis also complete. I just want to see whether how much you are aware, how much you all are aware. I want to see. Tell me which type of arthritis is present in old age, especially in the weight-bearing joints. Which type of arthritis is found in the old age, especially in the weight-bearing joint like the knee joint. The joint become utterly painful in old age, especially in obese people. Yes, but osteoarthritis, good. Many people are answering. That means you all are paying attention. Good. Arthritis, 3 types of arthritis we have discussed. Myasthenia gravis we have discussed. Now third one is muscular dystrophy. Now dystrophy, it is a progressive degeneration of skeletal muscles due to genetic diseases or genetic disorders. Due to genetic disorders, genetic causes, due to gene mutation. One of them is autosomal dominant and one of them X-linked recessive. The one that is Duchenne muscular dystrophy is X-linked recessive. You know that this protein is the largest protein. The gene dystrophin is the largest human gene, 2.4 million base pairs. If mutation happen in this gene, it leads to one of the type of muscular dystrophy. Dystrophin gene. Dystrophin gene, the largest human gene. How many? 2.4 dash base pairs. Then osteoporosis is age-related disorder, age-related, hormone-related. For example, in menopause, after menopause in females, after menopause, due to low level of estrogens, there is a decreased bone mass, and increased chances of fractures. there is decalcification, the decalcification of bones. The bones lose calcium, the mineral. Decalcification, D matlab out. It is generally age related. If it is not due to other disease, it happens in old age. You, me, all of us would be having this at one time of the life. You must be thinking, sir, you are a man. There is no menopause, no beta. Of course, there is no andropause even. But even in very old age, when the testosterone level is very, very low, after 65 years, 70 years, then the bone mass decreases. The same what estrogen decrease causes in female, little earlier than male. So please understand age-related disorder. So muscular dystrophy, osteoporosis, arthritis, three type of arthritis, myasthenia gravis. Is there any other disease that we are supposed to do, bachcho? Any other disease we are yes, 2.4 million. 2.4 million. Parathormone, yes, oh, titani, okay. Titani. Who are wild animals? Wild animals are the animal which we cannot control. For example, like tiger, lion, we cannot say tiger, sit, no. We cannot say tiger, up. Dog, we can manage a dog. Sit, we can say. Because we can control the dog. It's not a wild animal. Wild animals cannot be controlled. Similarly, if contractions happen in the muscle without any control, they are wild contractions, wild. Rapid spasms. Spasm, muscle contract without there is a relaxation, muscle contract again. No relaxation, muscle contract again and again, muscle contracting without relaxing. Muscle is contracting again and again without relaxation. This is called spasm. This is due to electrolyte imbalance. Don't worry. It is not a serious disease. It is temporary. This tetany is due to electrolyte imbalance. It is due to electrolyte imbalance. Which electrolyte? Calcium level. Thakwa. Okay, calcium thakwa ikra. Option number 1, in the body fluid. Option number 2, inside the sarcoplasm. Option number 3, both inside the body fluid as well as in the sarcoplasm. So what is the reason for wild contractions? Come on, bachcho. Inside the body fluid or inside the sarcoplasm? No, both nahi. Chalo, both. I am removing the answer. Inside the body fluid. Low calcium in the blood. Low calcium in the blood. Very good. It is because of low calcium in the blood. Bachcho, can I say? I'm telling you that this is hypocalcemic tetany. Hypo means thakwa. Calcium in the emia, blood. Tetany, hypocalcemic tetany, it also due to low level of parathormone. Low level of parathormone causes hypocalcemia, which causes tetany. So generally they don't mention about parathormone, but if they say that the tetany due to parathormone is related to, very simple you can say it is because of hypocalcemia. Parathormone tetany, electrolyte imbalance tetany, hypocalcemia. But this is clear. With this we come to the end of this chapter. I'll start with you the neural control and coordination. There are some words here. For example, there is a word called integration, synchronization, synchronization. So coordination. My hands are moving in a coordinated manner. How much stroke I have to make, how much pressure I have to put, which color I have to use. It is all in a well coordinated manner. The color that I see, so what happens? The retina sees the color, the light falls on retina. Retina converts that signal in electrical impulse taken to the brain. And the brain analyzes and accordingly send the efferent signal. Okay, now change the color. Okay, now do this, do that. Make the stroke like this, clean this. So I'm cleaning because my retina sees something and accordingly my actions. So stimulus, receptor detect it. Then convey it to the CNS. CNS integrate it with the efferent signal and the efferent signal go to the effector. Suppose if I'm walking and I find that, say in the classroom, I'm walking, I'm teaching and there is a platform. I make sure how much I have to move. I won't move, I don't fall down. Usually no one does. Why? Because we are moving, we know that. We are getting a signal from the eyes that this is the edge and we have to go to the edge. So our action is well coordinated. And where is this integration happening? That yahan tak ka edge hai. Brain gets the signal, light, and then this is integrating, bro, move only till here, don't go beyond this. So these words will be used: integration, neural control and coordination. Then please understand there is something called point-to-point control. Point-to-point control. Which one? Point-to-point control. Neural connection or neural control is characterized by point-to-point control. One point to other point. For example, from this point, the signal is taken directly to the organ. For example, if this nerve cell decide that we have to move, the signal will go to the muscle fiber and the muscle fiber will contract. The response will be done. Isn't it? Unit called Chepandi. What is this unit called? A motor neuron and a muscle fiber. Yes, I know you know this answer. This is called motor unit. How many motor unit you see? One. What is one? The one motor unit. One. What is one? One is the motor neuron because the muscle fiber can be one or can be more than one. One motor unit. This is a point-to-point connection. This is for rapid coordination. Rapid. It is for rapid coordination. This is unlike the endocrine coordination or chemical coordination. In chemical coordination, one endocrine gland is producing the message in the form of chemicals. And these chemicals are now going into the blood, or it can go into, and it will go into the lymph. And then it will be taken to all the trillions of cells in the body. It will be taken to all the trillions of cells in the body. But only the target cell of this chemical, the target cell, and who is the target cell? The target cell is the one who has a particular receptor. The receptor for that particular chemical. Suppose the chemical is like triangular shape. You can imagine the chemical as having a shape, and this is like, and they can fit into each other like a lock and key. So this cell is the target cell. Other cell may have other receptors, but they are not the target cell. There are trillions of cells in the body, and all of them are coming in contact with the hormone, but they are not responding. Only the target cell will respond. And who is the target cell? The cell which have the specific receptor. You can imagine receptor in the form of the chair. But generally, anyone can sit on any chair, but these chairs are very, very specific. Only that particular hormone can sit on this chair. And once they fit like a lock and key, then the effect is possible. So many other receptors are there on other cells, but the receptor for this particular chemical is only found on one cell, and this cell can be said to be the target cell. So this is the target cell. This can be called the target cell for the chemical of this shape. So this is diffuse. Any disadvantage? As such, there is no advantage, disadvantage. Our body requires both the type of responses. Yes, characteristically, the previous one, the end-to-end, the point-to-point or end-to-end, it is for rapid coordination, for quick coordination, quick coordination. It is for quick coordination. I have to send a signal, I have to send a message to you. I send the signal in the group, Telegram channel or WhatsApp channel. Then what happens that this channel, so many subscribers are there, maybe let us say 300 subscribers. It has gone to every one of them, but this message is only meant for some people. So when they will see that, they will respond. Otherwise, all can see, but it is not meant for them, so they won't respond. It may take some time that when everyone will see, then only those people, those students will respond. But suppose if I have to do quick coordination, I can directly send the text message to that person. Ki beta, you were saying about this question, this is the answer of that question. So point to point, from this end to that end, point to point. Here the signal is passing in the form of a text message. Here the signal is passing in the form of a nerve impulse. A nerve impulse can also be called as the action potential. A nerve impulse can also be called as action potential. Here the signal is passing in the form of the chemical messengers. And you know these chemical messengers, these are called chemical messengers. Chemical messengers, the Latin word for chemical messenger, we can call them as hormone. So we require both of them. Our body requires both of them. Both of them have some advantage, disadvantage. In certain situation, we require one type of control. In certain situation, we require another type of control. I hope, Bacho, you have understood about the word coordination, about chemical coordination and neural coordination. The neural system, the unit of the neural system is a nerve cell. A nerve cell can also be called as a neuron. A neuron has basically two parts. It has two parts. One is a cell body and one is the axon. It has basically two parts, a cell body and axon. This part and this part. These are the two main parts of a nerve cell or a neuron, which is a unit of a nervous system. Please understand that in a nervous system, there are no 100% neurons. Please understand, if I take out the nervous tissue, if I take out someone's nervous tissue, more than 50% of the volume is not occupied by the neurons. Neurons are less than 50%, less than one half. more than one half of the tissue of the volume is occupied by some other helper cell. We can call them as supporting cells. What we can call them? Supporting cells, or we can call them neuroglial cells. They are non-excitable. They are not excitable. They are not excitable cells. But they help in variety of ways. They help in variety of ways. More than around 50%, one half. So more than one half, I'll write more than one half. A group of cell body in the nervous tissue, it is organized by a group of cell body. There can be group of fibers. What do you call this group of cell body? In a nervous tissue, what do you call this group of cell body? Any idea? We have a word called G. And what do you call this bundle of fibers? We can call them as nerve. The bundle of fiber is called nerve. Plural is nerves. Nerve, nerves. And what is this group of cell body called? Yes, you are right. The group of cell body called ganglion. The plural of ganglion is ganglia. Ganglia, plural. Very, very important point. Very, very important. I said that in a nervous tissue, the nerve cell or neurons are the basic units. They are the basic units. They are the basic units, both structural and functional units. I said that there are two main parts, cell body and axon, fiber. The axon, when we say fiber, we actually refer to the axon. But when we say muscle fiber, we refer to the mottam, complete muscle cell. Then ganglion and nerve. A group of cell body is a ganglion, a group of fibers is called a nerve. Then I said that it's not that 100% neurons only. There are more than 50%, more than half of the volume is occupied by the glial cell. Some example of glial cells. Example of glial cells. For example, the Schwann cells. You might have heard about the Schwann cells. I will only give the example that we are supposed to know. Oligodendrocytes. Schwann cells, Okati Rundu, oligodendrocytes, and many others. Many others. Remember, these are not the excitable cell. They are not the nerve cells. They are the glial cells, supporting cell, housekeeping cells. They are the housekeeping cell. Bacho, we can divide the type of neurons. The type of neurons on the basis of how many dendrites it has. I said to you that minimum there is a cell body. Minimum cell body and minimum an axon. Minimum. This is there in all the type of neurons. A cell body and axon. Minimum. Now there can be no dendrites in the first case. There can be only one dendrite. There can be only one dendrite in the second case. But in the third case, there can be more than one dendrites. In the third case, there can be more than one dendrites. So number of dendrites can be 0, can be 1, and more than 1. These can be called as the unipolar neurons. These can be called as the bipolar. These can be called as the multipolar neurons. Unipolar, bipolar, multipolar. Unipolar, zero dendrites. Axon and cell body is minimum present in all. This is present in all. This one and this one. But then it is the number of dendrites. The number of dendrites which are controlling. Dendrites, the number of dendrites. Unipolar, bipolar, multipolar. Unipolar are found in the embryonic stage. Where? Embryonic stage, bipolar, in the middle layer of retina. Multipolar, most of the neurons, for example, we have at the cerebrum, we have the multipolar. The most of the neurons in the human body are multipolar, having many dendrites and one axon. Please understand, bacho. This is the most common type of the axons, type of the neurons. Please understand, there are some terminology to be used here. This is axon terminal. These are the dendrites. The dendrites can be called as the input zone. The axon terminal can be called as the output zone. This axon can be called as the conduction zone. And this portion, the beginning of the axon, is the axon hillock. It can be also known as AK, also known as trigger zone. It can be called trigger zone because action potential, if the action potential is triggered at this point, it will go all the length of the axon, will not stop, and it will only end at the end of the axon terminal. It will go till the end of the axon if it is triggered from here, just like a bullet. But so please understand, a very important point, very important point. Please understand. See, before this point, there is no action potential. After this point, there is no action potential. Action potential begin here and end here. So before this, you have got different potentials, which is not action potential. We can call them as excitatory potential. We can call them as inhibitory, excitatory or inhibitory. Graded potentials, of different graded potentials, excitatory or inhibitory graded potentials. Before this point, before the axon hillock, there can be excitatory postsynaptic potential or inhibitory postsynaptic potential. There are a variety of grades like +10, -10, +20, -20, +15, +12, -7. All these are different excitatory or inhibitory graded potentials in the dendrites and the cell body, but when their sum equals to the threshold, when the sum is equal to the threshold, then action potential is triggered. The action potential is triggered at this point. So the summation of all of them, all of these, the graded potentials, the summation occur at the axon hillock. And then from here, the action potential is triggered. So the action potential, therefore we call it as action potential because it is a potential in action. It will not stop like a bullet. Once it is triggered, it is triggered. input zone, conduction zone, output zone, trigger zone. Input, output, trigger, conduction. Let me write the numbers. But before that, before turning to the next page, tell me which one can also be called as the afferent, afferent zone. Which one can also be called as the afferent zone? Which one can also be called as the efferent zone? If you tell me afferent or efferent, A or E, apple or E, elephant. Come on, बच्चों. हाँ, तो फर्स्ट वाला क्या है बेटा? फर्स्ट वाला इनपुट जोन क्या होगा? व्हाट इज इनपुट? यस, इनपुट कैन आल्सो बी कॉल्ड एज द efferent zone. Efferent zone. Input can be called as the efferent zone, and output can be called as the efferent zone. Efferent zone. Output zone can be called efferent zone. Please connect both the chapters, structural organization and also the neural control and coordination when you are doing this topic of neurons. Please do not do them separately. Do them together. The four zones are there. The four zones, paper will be asked in these four zones. In the question, we can ask about the type of neurons, the basis of the classification. The basis of the classification mainly is the dendrites, not the axon. Then we can ask you what do you know about the ganglion, what do you know about the nerve. We can ask you about the supporting cells, glial cell. They are non-excitable cell. More than one half of the volume is occupied by the glial cell. And then we can ask you about the different nature of the chemical control and the neural control. Chemical control, neural control. A scientist, his name was Nizil. A scientist, his name was Nizil. You know what he discovered? He discovered that in the cell body, there is a special type of collection, a special type of collection of a special collection of बोलो बेटा. Polyribosomes, collection of polyribosomes. Also, one more thing, बच्चों, one more thing, you find that the axons are not naked. They are always covered by these special cells. Remember, this is one of the example of the glial cell. One of the example of glial cell. These cells which I am showing with these boxes, these are called the Schwann cells. These are called Schwann cells. And this is the axon that you see. Axon, this is axon terminal. Axon terminal. These are legitimate cells, beta. These are legitimate cells. That means they have nuclei. They are legitimate cells. This is the nucleus of the cell body or cyton. The nucleus of the cell body or cyton. Cyton or cell body. You know, these branches can be called as the branches of tree. These are called the dendrites. These are called Schwann cells. What cell? Schwann. They are for support of these. You might find it very unusual. Sir, what are you saying, sir? Is it for support or is it for making myelin? I'm sorry, but I'm telling you the truth. It is for support. Schwann cells always surround the axons, always surround the axon. If I take a section of them, if I take a section of the Schwann cell, you will find that inside that the axon. So I'll first make the axon. So this is the axon. Axon, this color is axon, this is exoplasm, and this color, the onion color, this color is the Schwann cell. The Schwann cell is like a chapati. Okay, it's like a chapati which is rolled around, like a chapati which is rolled around the axon. And this one is the nucleus. This is Schwann cell. What is this? This is Schwann cell. One more thing, you see this one. Identify what I'm drawing. I'm drawing something layer by layer, layer by layer, layer by layer. White color, glistening white color. It is nature, it is a phospholipid. The nature of it is a phospholipid layer by layer. We know that the Schwann cell make them. Identify this white color phospholipid layer by layer. White color phospholipid layer by layer. Come on, bachcho. Unless you write the answer, you won't see. Schwann cells make them layer by layer, white color. It's a phospholipid. This is called myelin sheath. The myelin words, they come from, myelin word come from sphingomyelin. But two class here, two classes.
Medical evening, sir. No timetable medical.
Actually, timetable, according to timetable, this is my online class.
Medical class also this time.
మొత్తం టైం టేబుల్ ఉందా చూడండి ప్లీజ్ మొత్తం టైం టేబుల్ I'll come there, no problem. हाँ जी बेटा, myelin sheath. The phospholipid pair is sphingomyelin. Phospholipid pair is sphingomyelin. But big word na is sphingomyelin, short form. Myelin sheath. Now sheath is not a sheet. It is sheath means covering. Covering sheath. But better, let me tell you one thing. That Schwann cells, it is not the duty of the Schwann cell. Always they are going to make online है.
Offline also 145 to 150.
अच्छा, crashing.
Online also. Classes.
Oh my God. Okay. Crashing time.
You take your afternoon.
No. This is about to get over. About to get over. कुछ 5 minutes खत्म हो जाएगा ये. 5 minutes. अब lunch time 10 minutes postponing. No problem.
10 minutes. No problem.
120.
You take 145 hours, no problem.
Hey, बच्चा लोग.
No problem. Take chapati breakfast.
अच्छा ठीक है. Request कर देना है, request.
Okay.
हाँ, फिर I'm just coming. No problem. I'm coming. ये तो ऑनलाइन क्लास है ना? Online class, na? I saw the online class I am taking. I thought that I have 2 classes. Myelin sheath. Yeah, it's the online class. वो कहते हैं कि clash हो गया है. Myelin sheath. This is a myelin sheath. But it is not necessary that the myelin sheath can be pakka around. But what is necessary is the Schwann cell pakka around. I mean to say that there are certain cell where you have the Schwann cell, but you don't have the myelin sheath. There are certain cell which don't have the myelin sheath. We can call them unmyelinated. These are myelinated, unmyelinated, yeah, non-myelinated, myelinated, non-myelinated, myelinated, non-churandi diagram, myelinated, non-myelinated. बेटा मुझे बताइए myelinated और non-myelinated में main difference क्या होगा? So I am writing here. So myelinated neurons and non-myelinated neurons. Non-myelinated neurons. Myelinated, non-myelinated. Tell me the presence of Schwann cell. Tell me the presence of myelin. And the speed of conduction. The speed of conduction of nerve impulse. Conduction of nerve impulse. The speed of conduction of nerve impulse. So,